This is Pop Health Week on Healthcare Now Radio. I'm Greg Masters, Managing Director of Health Innovation Media, the executive producer and co-host of the show. Joining me in the virtual studio is co-founder and principal co-host Fred Goldstein, president of Accountable Health, LLC. At Pop Health Week, we engage industry leadership and stakeholder voices spanning payer, provider, patient, vendor, and regulatory communities in population health best practices and strategy. Connect with us via www.popupstudio.productions or follow and direct message me on Twitter at GregMastersMPH, and that is Greg with 2 G's. On today's episode, our guest is Amelia Bedri, MHSA, Content Engineer and Policy Development Manager at the National Committee on Quality Assurance, also known as NCQA. Serving as subject matter expert for NCQA's health equity accreditation programs, Amelia leads the development cycle and maintenance of the core knowledge base of the healthcare industry and regulatory environment to enhance their standards and guidelines. She provides policy expertise to internal teams and external stakeholders, including the Centers for Medicare and Medicaid Services, state Medicaid agencies, managed care organizations, and
thanks so much,
care
Greg
delivery
and Amelia. Welcome to Pop Health Week.
Thank you so
and
much
with
for
that
having me,
introduction,
Fred. I'm really happy to be here, and I'm looking forward to our discussion.
Yeah, thanks so much. It was really a pleasure to participate with you on the panel recently and discuss health equity and social determinants of health. Why don't we start with you giving our audience a sense of who you are and your background?
Sure. So I am a content engineer working at the National Committee for Quality Assurance, better known as NCQA. And I've been here for over 2 years. And essentially what I focus on as a content engineer is really developing our standards, focused on our accreditation programs. So that ranges from, creating programs around addressing health equity. How do we hold organizations accountable for addressing health equity, whether that's a health plan, a delivery system, or different practices. But then we also have other accreditation products such as population health, credentialing, utilization management. So at NCQA, we really address a broad spectrum of sort of addressing quality within the healthcare ecosystem. And, I kind of sit within the space of accreditation, but we also have measures. We do research, we put out white papers, and we also have specific contracts and grants. So it's really a pleasure to be working at NCQA and getting a sense of where healthcare is going.
And how did you end up coming into NCQA? What were you doing before that?
Yeah, so prior to NCQA, I was working at MedStar Health, kind of doing some consulting work. So I've been in healthcare, in the healthcare space for a little while. I was working on their community health needs assessment. So I've always been in the space of community health, and my interests have always lied in health equity and understanding the disparities that exist within one zip code, let alone, across the United States. So I was working for MedStar Health, doing their community health needs assessment, and just getting experience, in how a delivery system works and how they are accountable for addressing health equity and allocating resources within such a large institution.
Fantastic. So you really came into this with NCQA to bring in that experience you had with community health, doing community health needs assessments, et cetera. And I mean, health equity is obviously a critical area. I've been through a number of NCQA surveys as a health plan, as an employee health improvement program, et cetera, fairly robust. Can you talk some about why NCQA said, hey, let's go in and start looking at health equity and providing certifications in that area?
Sure. So, NCQA has been committed to health equity since really, the inception of the company. But specifically in 2010, NCQA developed an accreditation program called the Multicultural Healthcare Distinction, which was really one of the first programs to address cultural competency, the collection of race and ethnicity data. And we know, those are critical components to beginning to look at where disparities lie within populations. So that was really kind of the introduction that NCQA had to addressing disparities through accreditation. And NCQA does standards, you know, that's our bread and butter here. So kind of with the pandemic and really all of the disparities that have been brought to light from the pandemic that has existed for years and years on end, and understanding the financial and economic impacts that it's had on so many different communities and populations, that's really put equity at the forefront on NCQA strategy. And so we really thought internally about, okay, how do we revamp what we have? How do we address equity through measurement? And that's what led to the creation of our health equity accreditation programs. So it's been a leadership initiative, but it's also been those in the organization that have been so passionate about this work that represent the populations that, we are giving a voice to. And, that's been the goal, and that's been the main driver of revamping what we have currently to meet market needs now, and also think about how do we hold organizations accountable in addressing health equity beyond what they're currently doing.
Mm-hmm. As you pointed out, obviously, COVID just sort of opened the wound. We knew it was there, it was out there, but that really exposed it to everybody, and more people definitely got interested in it. And it's great that NCQA stepped in this space. What sort of things do you measure? What are you looking for in that approach?
Yeah, that's a great question, Fred. And, that's been part of my role, is really thinking about, what are we actually measuring? What actually equates to a reduction in disparity? And part of that is collection of data. So really understanding, who is the population, what's their background, what are their cultural, what are their linguistic needs. So kind of understanding that to begin with has been a really critical part of how we're developing standards for our health equity accreditation programs. And then from there, also looking at, okay, if you're a payer, and even if you're a provider or delivery system, what are the practitioners within the network that, reflect the population that you're serving? So ensuring that the patients and members have access to providers that, reflect their cultural background, that can speak their language, where they see themselves represented, understanding just the historical mistrust that, many populations have in our healthcare system. So those are, really important components, and also measuring, how the organization that, for example, is coming through accreditation, how they are actually implementing actions, right? So once you've understood the population at hand, you get a sense of, the languages they speak, where they come from, and really looking at what are their needs. And then you can take a deeper dive into what does their health look like? And we know what a big part of outcomes are driven by are those social determinants of health. 80% of one's health is really determined by those social determinants of health, and where you live, your zip code. Do you have education? Do you have a job? Do you have a stable income? Those types of components as well we assess to ensure that healthcare organizations are looking at those factors within the populations they serve, and how they're developing plans and programs to really look at the person as a whole, not just within the four walls of a medical office.
Mm-hmm. And you have, as I understand it, there are two levels of certification now: the Health Equity Accreditation and the Health Equity Accreditation Plus. What's the difference between those two levels?
Yeah, so we developed two levels for the purpose of understanding the journey and to really meet healthcare organizations where they are. So starting with healthcare accreditation, or sorry, health equity accreditation. Health equity accreditation is meant for organizations, that are addressing health equity or are looking to formalize how they are addressing health equity within their organization. But it's really the first step, and that addresses the collection of demographic data, creating a program to address cultural and linguistic needs, and then looking at clinical measures to ensure, where disparities exist across those clinical measures. And then the next step of that program is Health Equity Accreditation Plus, which takes a deeper dive into those social determinants of health. So looking at, the zip code, the broader community of where members and patients reside, and really the systemic and kind of structural barriers behind why certain individuals have lower health outcomes as compared to others because of where they live, because they don't have access to transportation. So the first layer is really looking at, demographic needs and kind of clinical outcomes, while the second layer of the plus takes a deeper dive into why outcomes for certain groups are lower and really evaluates those upstream systemic kind of barriers that, many individuals face on a daily basis.
Mm-hmm. And you recently piloted the Health Equity Accreditation Plus, as I understand, with 9 organizations. Who were some of those, and what did you learn from that, or how did that pilot go?
Yeah, so the pilot was a great experience at NCQA. We develop products, with our customers in mind. But prior to Health Equity Accreditation Plus and the pilot that we conducted for that program, the pilot we did for Health Equity Accreditation Plus, we conducted kind of a convening with 9 organizations, 7 health plans, and 2 health systems. And working with those organizations in such a close manner was something that NCQA has previously not done before. So bringing on this pilot, at the inception rather than after the fact, has been a transformative process for NCQA. Typically when we develop our products, whether that's our HEDIS measures or our accreditation products, we have a public comment period that we disseminate to, the entire industry can comment. We have committees of experts such as, state representatives, those within health plans, and those subject matter experts. But doing this pilot, I think, has really transformed the engagement that we have with our customers early on. So working with them, these 9 organizations volunteered sight unseen, and, some of them range from the plans range from Elevance Health to United Healthcare, Molina Healthcare. So just different organizations. And, you can take a look at those on our website where we list out those each of those organizations. But, it was also great to work with the 2 health systems. And if you're unfamiliar with NCQA, our traditional accreditation customers are health plans. So NCQA, in developing our health equity accreditation programs, wanted to think about expanding beyond our customer base that we're familiar with, such as health plans. So we were really excited to work with the 2 health systems, Novant Health, located in the Carolinas, and then Hennepin Healthcare, located in Minnesota. So, they really range from the diversity of members they serve, from where they are geographically located, all across the United States. And, we sort of gave them an initial draft of the standards, and we gave them several weeks to operationalize on the standards and do a mock survey process, really. So they would help us think through whether the standards at the time were feasible, whether they were surveyable. And from there, we worked together across the period of over a year, having weekly touch bases with each of the 9 organizations. We also had group office hour sessions. So all of the 9 organizations could collaborate, they could learn from one another, they could see and understand their challenges and kind of their touch points across the organizations. And that really helped us to get to the state of, the standards that we published. And, if it wasn't for the pilot, we wouldn't be able to conceptualize how do we build a program to address social determinants of health and really measure improvement within that. But also think about, where the current industry is in addressing social determinants of health. There's not a lot of industry kind of standardization around measuring social determinants of health, and kind of, creating a glide path so organizations can prepare and, have internal trainings, build their internal infrastructure and systems to support addressing social determinants of health, but also explain what is NCQA's intent and rationale in, why we chose these standards and measures and kind of the end goal and leading up to the state that we hope to get to through these accreditation standards.
And if you're just tuning in, you're listening to Pop Health Week on Healthcare Now Radio. Our guest is Amelia Bedri, MHSA, Content Engineer and Policy Development Manager at NCQA.
And were each of the ones in the pilot, were they already accredited as under the Health Equity Accreditation one? Or did some of them come in just new without that?
I'll preface with saying there are 11 states that mandate either Medicaid or exchange health plans must achieve our health equity accreditation. So that's a huge driver from that mandate perspective. It was a mix. Some of the plans were accredited previously with our multicultural healthcare distinction, but then the health systems, they did not have the previous accreditation. So all of the organizations had to come through survey for both programs at the same time. So it was definitely a great learning experience for the organizations and expressing how our programs help them turn health equity from a hot topic to a sustainable business practice and really formalizing how health equity is addressed across their enterprise, understanding these are large organizations, how staff can be aligned on the mission, and really how the accreditation and going through the survey process and, preparing evidence for their survey allowed them to connect to other departments and really, collaborate more formally and internally and kind of get the ball rolling on some initiatives that had already, been kind of on some initiatives that have already been a priority for the organization, but may not have come to fruition yet because of, lack of budget or, lack of resources. But the accreditation really allowed internal goals to kind of be fulfilled. It was that vehicle to allow, some goals that within these organizations, they had been planning initiatives related to equity for years on end, but, there really wasn't kind of traction. So the accreditation allowed and pushed for that traction across these organizations. And, looking at some of the plans who started with their Medicaid lines of business for this accreditation, now, other lines of business within the same organization are really coming to them and saying, we see your success and we want to follow suit.
And is there a difference I know you said you had some that were providers and some that were payers. Is there a difference in sort of the measures or any of the process or outcomes you're looking for based on whether you're a provider or a payer?
The outcomes we assess for either a plan or a provider are going to be the same. So they are the same standards that are applied to any organization. There can be some exceptions, depending on some standards that might apply, for example, reporting of HEDIS measures, understanding that HEDIS measures are really only applicable, the reporting piece, to health plans. So providers would be exempt from that requirement. But as part of, learning from surveys and the plans and different providers that come through, we hope to really uncover some key insights and how plans are addressing health equity, how providers are kind of taking a different approach. Data collection has been a huge topic and, is a huge pain point in the industry for different stakeholders. So we want to create case studies and really highlight examples so that plans can see themselves represented in those plans that have successfully achieved the accreditation. And likewise for providers and, utilizing these pilot organizations so they can share their success and how providers have come through an NCQA accreditation. So, we hope to create case studies from any type of enterprise, different business operation that comes through the accreditation.
And I know when I went through it at U.S. Preventive Medicine, obviously with our employee health improvement program, and I can't remember the specific accreditation, whether it was population health or employee health improvement, but I remember we had the initial level, and then we went back and got the one with outcomes. And when you talk about outcomes within the current survey spectrum you have of the health equity accreditation and the health equity accreditation plus, when you're looking at outcomes, is it that they're doing something to improve the health of the population, or is it that at the end of the day there was a measurable improvement in the difference in disparities between populations?
So it's really twofold. It's there are certain requirements where we are looking at how an organization identifies a disparity, how they identify an opportunity to address that disparity. And then the third part of it, kind of implementing a quality improvement process framework, how they are taking action to address that disparity. And then part of that, some standards take a deeper dive to look at, okay, you have implemented this initiative. Is it improving the health of your members? What feedback are you engaging from your members to ensure that it's meeting their needs? So there's also that component of member engagement throughout that, quality improvement process of, we are evaluating how the organization is providing evidence, that they are implementing an action, but also tracking improvement, and whether they need to pivot because, there are no improvements made within the year or within 2 years, however many, years the organization has allocated to tracking that initiative, but also, again, engaging the members throughout the process, engaging members and creating initiatives and establishing goals for addressing disparities, and ensuring that their input is brought into that improvement cycle as well.
And I know that I mean, when we think about this and we look at, there are some times where, like, let's say we had to apply for an RFP and they would ask, are you NCQA accredited? If you don't have an accreditation, we're not going to, respond to you positively and hire your organization. And there are some accreditations that are like that. And then there are some, I assume, that are like this, which maybe isn't directly related to being asked for, although it might be asked for as a positive. Do you see or hear that health plans or others are saying we're gonna take this on? We want to get ourselves accredited. Has it become something that now they recognize we need to do it? So this is a way to prove that we've done it.
NCQA conducted a pilot to develop the Health Equity Accreditation Plus standards, and we worked collaboratively with 9 organizations, 7 health plans, and 2 health systems. So, looking at those health plans, just to list them all, Aetna Better Health of Michigan, Geisinger Health Plan, HealthNet of California, Molina Healthcare of California, Simply Healthcare Plans, United Health Care Community Plan of Michigan, and lastly, UPMC Health Plan. And the 2 health systems that we worked with, it was really exciting to work with these healthcare systems as they are typically a newer customer for this accreditation program. We worked with Hennepin Healthcare located in Minnesota, and lastly, Novant Health in the Carolinas. Some providers are starting with one of their hospitals and then planning to expand to all of the hospitals across their health system. So it's definitely rising change across organizations.
And it always helps. I mean, if somebody's looking over your shoulder, you're going to do things better. You're going to do things differently. You're really going to try to get it done. And I think having those standards is very helpful in this area. As you think about all the work that it took to get the first 2 sort of going, do you see a next round? Where are you working on with this now?
NCQA is always iterating on ways to improve equity, whether through new programs, looking at our existing programs. So that's been a lens that we are looking at internally is, what existing opportunities do we have to add equity and really embed equity into the offering? So, for example, NCQA has a long-term services and supports accreditation program that has been established, for a couple of years now, and we are revamping the program, and health equity is one of the major components that we are adding to that accreditation. Understanding equity is a huge component of the long-term services supports population, thinking about those with disabilities, with multiple complex care needs. And, that's been a huge driver of us thinking about how do we expand equity into different populations that really need those services. We're also looking at NCQA's health plan accreditation, which is really kind of the staple accreditation product for NCQA, and how do we embed equity across components of health plan accreditation, which evaluate population health management, utilization management, assessing network adequacy. So we're also looking at developing, potentially new programs for other organizations that can support these health plans and health systems. So looking at potentially different vendors who support, this health equity work, because NCQA believes it's not one organization alone that can assess and really improve health equity. It's the collective impact. So we're thinking about new ways to create programs, iterate on programs, or, different ways to assess equity for different stakeholders in the industry.
That's really, it's fantastic. As I think about this whole issue of health equity, that's the bedrock of population health. If we want to improve the health of populations, we have to get the health equity issue solved. The dramatic improvements in health we could see by just bringing everybody up to that level, to the same level, would just be fundamentally incredible. So I want to thank you so much, Amelia, for joining us this week and discussing what NCQA is doing in this area. Fantastic work. Thank you.
Thank you so much, Fred, for having me.
And back to you, Greg.
And thank you, Fred. That is the last word on today's first broadcast of 2023. I want to thank Amelia Bedri, MHSA, Content Engineer and Policy Development Manager at NCQA, for her time and generous insights today. For more information or to follow Amelia's work at NCQA, go to www.ncqa.org/health-equity, and do follow them as well on Twitter via @NCQA. And finally, if you're enjoying our work at PopHealth Week, please like the show on the podcast platform of your choice, share with your colleagues, and do consider subscribing to keep up with new episodes as they are released. We stream live on Healthcare Now Radio weekdays at 5:30 a.m., 1:30 p.m., and 9:30 p.m. Eastern, and for you left coasters, 2:30 a.m., 10:30 a.m., and 6:30 p.m. Pacific. For Pop Health Week, my co-host Fred Goldstein, this is Greg Masters saying, please stay safe, everyone. Bye now.